340 search teams were sent to Hubei with 42,000 health professionals between January the 26th and April the 6th. Beijing Hospital sent 151 health professionals in 3 ranches to Wuhan, and they took over an entire severe case ward and a critical case ward in a wing of Tongji Hospital. They treated 100 COVID-19 patients with a cure rate of over 90%. Today, we have with us the representatives of the Beijing Hospital in the search team, President Wang Jianye, head of the National Medical Team and President of Beijing Hospital, Vice President Xi Huan from Beijing Hospital, Deputy Director Chang Zhigang from the Surgery ICU, Deputy Director Xu Xiaomao from the Department of Internal Medicine and Respiratory and Critical Cases Department, and the Deputy Director Wang Xia from the Nursing Department to take questions from the media. First, some updates on the pandemic. In the 24 hours of April the 28th, according to reports from provinces, cities, and Xinjiang Production Construction Corp., new confirmed cases 22, including 21 imported cases, 20 in Shanxi, 1 in Shanghai. 1 new confirmed case was domestic case. There was no new death. New probable cases 2. 1 in Inner Mongolia and 1 in Shanghai. Both were imported probable cases. On the day, newly cured and discharged from hospitals 23. Close contacts that were removed from medical observation 627. Updates on imported cases. Remaining confirmed imported cases 553, including 22 severe cases. Remaining probable cases 7. Cumulatively confirmed cases 1,660. Cumulatively cured and discharged from hospitals 1,107. There was no death among imported cases as of 24 o'clock, April the 28th, according to reports from provinces, cities, and Xinjiang Production Construction Corp. Remaining confirmed cases 647, including 50 severe cases. Cumulatively cured and discharged from hospitals 77,578. Cumulative deaths 4,633. Cumulatively reported confirmed cases 82,858. Remaining probable cases 10. Cumulatively traced close contacts 731,910. Closed contacts that remained under medical observation 8,283. In Hubei Province, on the day, there was no new confirmed cases, no remaining probable cases. Cumulatively cured and discharged from hospitals 63,616, including 46,464 in Wuhan. Cumulative deaths 4,512, including 3,869 in Wuhan. Cumulatively confirmed cases 68,128, including 50,333 in Wuhan. According to reports from provinces, cities, and Xinjiang Production Construction Corp., new asymptomatic infections 26, including 5 imported asymptomatic infections. On the day, 1 were transferred to the category of confirmed cases. On the day, 29 were removed from medical observation, including 4 imported asymptomatic infections. Those who remained under medical observation as asymptomatic infections 993, including 131 imported asymptomatic infections. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 1,511, including 1,037 in the Hong Kong SAR, 45 in the Macau SAR, and 429 cases in the Taiwan region. On 28th of April, cumulatively confirmed cases across the world reached almost 3 million. Cumulative deaths exceeded 200,000. In some countries, there has been a rapid increase of cases, bringing about new challenges. For China's defense against imported cases, we need to improve landway, airway, port control, to improve NAT tests, mass quarantine, and medical treatment capacity so as to safeguard the line of defense along border ports. Now we'd like to take questions from the floor. Please ask questions on today's topics, and please identify yourself before you address the questions. Journalist from the first row on the left side, please. Thank you. With the CCTV financial channel, we know from the very beginning of the outbreak, most medical teams left their original places at the eve of the Lunar New Year. How did the Beijing Hospital set up its medical team? What was the principle of the organization apart from respiratory diseases and ICU? What are other departments that have been involved in the combination of medical team, and what has been their roles? I'd like to ask President Wang Jianye from Beijing Hospital to take the question. Thank you for your question. The Wuhan assisting medical team organized by Beijing Hospital was not the earliest. The earliest team was from Shanghai and Guangdong. We were 1 day later than our peer medical team. Every health professional was very concerned about the epidemic unfolding in Wuhan. Being an administrative leader, all the health professionals, we had the keenly feel that we were about to leave. On 25th of January, we received the instruction from National Health Commission. That was the eve of the New Year. The first trench had 20 of us. Within 3 hours, 640 health professionals from our hospital volunteered, and we selected some out of them based on the following considerations. The first batch of medical health professionals were from respiratory departments or ICUs for the treatment of critical cases. 12 days later, the second medical team from our hospital went to Wuhan. On top of the information from the first medical team, we had our initial understanding of the peculiarity of the COVID-19. So the second batch is multidisciplinary for the treatment. On the front of nursing, apart from the basic nursing services and cares, we focused on the specialized nursing, like the respiratory therapists, those who are very familiar with ECMO or who are familiar with the blood purification.
Just now, the question was about other disciplines. Actually, in our hospital, we also have the practitioners from the cardiology department, because we found many patients suffering from the cardiac diseases. And also we have doctors and nurses from oncology and other departments. one highlight is from the Department of Radiology. We have a chief from the Department of Radiology, and he was an expert in reading the images. He played a very important role. He has helped us to review all the CT scans and the images of the patients, and also he conducted the screening on the images from the follow-ups. Later, when some patients had the negative NAT result with the CT scan or the images, we found that the patients have not recovered yet. So he played a very important role. Among the more than 100 patients that are severe and critical patients, except 4 or 5 deaths, we have not had any patient who returned back to the positive NAT result, and this is attributable to this is credit to our radiology as expert, and also we have rehabilitation expert who is helping the patient to recover. So that's the main situation. Okay, let's continue. On the right, the front row, the second lady reporter, please. Thank you. With Xinmin Evening News. My question is for the medical team. When you arrived at Wuhan, what was the situation in the hospitals, and how about the local doctors and the patients? What did you feel? And also, were you prepared to see such scenario? We will have Dr. Chang to answer the question. Thank you for your question. The first medical team arrived at Wuhan on the second day of the Lunar New Year. It was truly the darkest moment. We had a large number of patients but limited hospital beds. When we arrived, the local hospital was just designated as the hospital to take in COVID-19 patients. In less than 24 hours, they were successfully changed into such a designated hospital. Previously, the hospital was not an infectious disease hospital, so the wards were not able to be directly changed into the negative pressure wards. That's why we had the transformation of the wards. As there were a lot of patients, we had to accomplish the transfer within 48 hours. So the Zhongfa Xincheng ward received the medical teams from all over the country, including us. When we arrived, the local doctors and the nurses had already been working in the front line for about a month. They were busy working, but we found they were highly motivated. As for the patients, there were a large number of patients. Many patients were quite anxious as they had not been hospitalized yet. They were also worried that the infection may be spread to their family members. At that time, as there were a large number of newly increased or newly confirmed cases, patients were quite worried and anxious. Also, the doctors and the nurses were wearing the head mats, and also the patients were quite concerned. When we arrived, frankly, we were a little bit nervous. However, we didn't have the time to feel worried for ourselves, because our sense of responsibility and our professionalism encourage us to be devoted to the work. At that time, people knew very little about COVID-19, and the number of new cases was rising rapidly. We were a little bit concerned whether our protective devices or the supplies are adequate. Also, we found some media reports about the hospital infection. However, such concerns and worries disappeared once we got devoted to our work and we gained more knowledge about COVID-19. We received a notice in late evening of the first day of the Lunar New Year, and we took off on the second day, so we didn't have much time to get well prepared. But anyway, we were busily making the preparations and working together, shoulder to shoulder with the local doctors and nurses. Okay. On the right, the second row, the third reporter, please. With CCTV, we know that many COVID-19 severe cases were elderly patients with underlying conditions. It is reported that the eldest patient was 102 years old. How about the eldest patient that you have received? What are the treatment measures that you have taken? We will continue to have Dr. Chang to answer the question. Thank you for your question. The average age for the patients we receive is over 60 years old. The eldest one was 92 years old, a male patient, and a severe case transferred from other hospital. At the same time, the elder patient had underlying conditions and complications like high blood pressure. So the prognosis for such kind of a patient may not be so good. For his case, we attach great importance, and he became our priority, one of our priority patients. Every day in the morning, we give him specific counseling by joining the efforts of all the experts, the oxygen therapies, and organ support, as well as the control of the glucose and blood pressure, are all the treatment measures we have adopted for him. Also, with his chronic conditions, the COVID-19 symptoms may be worsened. So for these patients, for such patient, we think that it is necessary to make a sound balance between the NCD control and the treatment of COVID-19. Thanks to the multidisciplinary coordination, this patient got recovered. Okay, thank you. On the right, on the fifth row, the third lady reporter, please. Thank you. With National Business Daily, we noticed that the Beijing Hospital, the team from the Beijing Hospital, had a highlight, that is the engagement of the TCM. In the hospital, the TCM department is also a featured department. Could you please share with us your experience in using TCM to treat the COVID-19? We will have Dr. Xi Huan to take the question. Thank you. Just as President Wang has mentioned, in building the team to Wuhan, in particular the second team to Wuhan, when we have 123 members, we have already considered the makeup or the construction of such team.
We selected the executive director of TCM, and he was a member on this team. When he worked at the frontline, he had one-on-ones on a daily basis to learn about the progression of each case. We with the consent of the Tongji Hospital, we used the particles, TCM particles. We know that for the herbal medicines, usually we will have to cook the decoctions, but it may not be very convenient. But we got the consent of the Tongji Hospital, and we worked out individual-based, specialized or personalized decoction for the improving of the spleen, the cleansing of the dampness, and the removing and the clearing of the sputum. TCM doctor focused on consent-based prescriptions, but gave consideration to the personalized treatment to be engaged in dialect treatment. On a daily basis, there was statistics collected on the information system. TCM utilization in the world was 95% and above. Individual critical cases with the ventilators could not take decoctions, but for almost most of the others, we used TCM as a combination of treatment. Many of our specialists felt that the introduction of a TCM played a major role in improving the cure rate. We also got very positive feedback from patients. The Western medicine does not yet have an effective therapeutic for COVID-19. So for the treatment of all COVID-19, we adopted comprehensive or combined methods. TCM played an important role in the combination of treatment. They were also well received by the patients. Thank you. Thank you. Next question goes to the journalist on the second row on the left side. Thank you. With the CCTV Society and the Law Channel, I'd like to salute all those sitting on the podium for fighting for Hubei. We know during the most crucial time, there was a severe shortage of hospital beds. Apart from this, what were the greatest difficulties you've encountered, and how did you overcome such difficulties? I'd like to ask Dr. Xu Xiaomao to take the question. Thank you for your question. Yes, indeed. In the first month, we encountered a lot of difficulties. The greatest one was the lack of protective units and gears. That wing of the hospital was a newly renovated one for the treatment of COVID-19 patients. A dozen of medical teams from across the country have come to this wing of the hospital. So each day there was a great need for the medical supplies. And patients swarmed into this wing of the hospital were mostly severe and critical cases. So we were in shortage of the ICU equipment. To deal with the difficulties, we counted on the hospital staff. They did a whole lot of logistic support. They tried all means to satisfy our medical supply needs. Some may came in 1 to 2 days later, but anyway they came. We owe them a lot. We also brought with us personal protection equipment, and that satisfied some of the urgent needs when we were working in the hospitals. Beijing Hospital had been saving on themselves. The N95 respirators were only distributed to fever clinic colleagues. And back in Beijing, our colleagues were saving every penny to ensure that extra supplies can be provided to us. In face of the shortage of such medical supplies, the ECG monitors and also the ultrasonic monitors, respirators, and other ICU equipment were transported to us from our home hospitals. Apart from that, we received donations from all sectors of society, like the blood oxygen sets monitors, and also disinfectants were in donation. And also, we were donated the medical and the daily supplies. The greatest attention was during the first month, because that was during the Spring Festival break. Many manufacturers were in suspension, but anyway, we got through it together. Thank you. Next question goes to the journalist on the third row on the right side, please. Thank you. With the Hong Kong Economic Herald. Health professionals are also ordinary people. They have family members back home. Were you ever worried that you might be infected? What were the measures adopted to ensure the health professionals' safety? I'd like to ask Deputy Director Wang Xia from Nursing Department to take the question. Yes, indeed, we were once worried. Beijing Hospital has an annual patient visit of over 2 million and plus, but most of our departments didn't have much experiences in contacting infectious disease patients. From the very beginning, we were working in an unknown environment in face of an unknown virus. However, none of us had fear, and that was because the help and the support from our home hospital, Beijing Hospital, and also the host hospital, Hubei Hospital. In IPC, we have set up an IPC monitoring team composed of 8. 2 of the 8 experts were the specialized staff from the IPC department, and there were also nurses who were engaged in the 2003 SARS converting. So they had rich experiences in IPC, in particular when medical staffs have to go in and go out of the severe case zones. Then their personal protective gears will go through disinfection and replacement. Many training and information were provided to ensure their safety. In the contaminated zones, clean zones in the hospitals, and also the residents' place prevention and control measures, the needle injuries and other emergency situation preparedness plans have been worked out. The directors from these and the leaders from the medical team emphasized that whenever health professionals have to go in or go out of the contaminated zones, they must go in pairs. So if their emergency happened to one, the other one can come in to help. On one hand, we have been implementing strictly the measures to monitor the health conditions of the team members. Once there is discomfort, they will immediately take their break or go through tests. And also we have standby team members to come to replace them in case of emergency. We've been focusing on providing psychological care and counseling to all the team members. And when we arrange health professionals in pairs, we tend to choose psychologically stronger ones to be working in pair with the psychologically weaker ones so that they can boost the morale and courage. Next question goes to the journalist on the third row on the left side. Thank you. With the 7 Metropolitan News, it was reported that among the medical team from Beijing Hospital, many members were involved in the 2003 SARS fight. What was the difference from the 2003 SARS response?
Dr. Wang. Okay, we may have Dr. Xu, Professor Xu, to take the question, because in the year 2003, when our hospital received the first SARS case, it was him who received the patient and treat the patient. Okay, thank you. We will first talk about treatment, and then I'll give the floor to Madam Wang Xia, the head nurse of our hospital, to take the question. In our team, there are 8 colleagues who used to be engaged in the SARS response. Their experience serves as important reference as well as the source of confidence. As you know, the 2003 SARS happened 17 years ago. At that time, the capability and the equipment we enjoy were not at the same level as today. We didn't have the N95 respirator nor the protective gears, so we were poorly protected. But in the COVID-19 response, our protective facilities and protection are really much better. We emphasized that there should be rigid procedural requirements to be followed. We request our members to look at the wall, because on the wall there is detailed instruction about using the protective supplies. Secondly, compared with 17 years ago, the protective supplies we enjoy this time are way better. That's why one of the colleagues said that this time we are much safer. And also with the participation of the SARS colleagues, we feel really encouraged and very confident. For SARS, the case fatality rate was 6.5%, while for COVID-19 it was about 5.5%. Also, the SARS lesions mainly occur in the lungs with difficult breathing and some other respiratory symptoms. However, for COVID-19, it's not just about the respiratory system. It actually affects many other body organs like the reproductive system, the cardiovascular system, the immune system, and etc. In terms of the treatment, compared with what we did 17 years ago, we found that there's a great improvement. First, in terms of the drug use, we now have many antiviral drugs available, and also the nutrition support drugs, which have enabled us to ensure the success of treatment. Also, we avoided the use of steroids or hormones in the large quantity. By doing so, we reduced the side effects of using the large quantity of steroids. Also, we have used many advanced technologies like ECMO and the bedside respirators or ventilators. ECMO was the most leading equipment and the technology. On March the 3rd, we had a patient who was only 47 years old, quite young, but all of a sudden we found the cardiac arrest of the patient, and the oxygen saturation of this patient was not good. And then we had quickly convened the expert consultation and decided to apply ECMO. So Dr. Chang, together with experts and physicians or practitioners from different departments, and applied the ECMO to the patient. Once we successfully started the ECMO, we found that the patient's oxygen saturation quickly increased from the previous 80% to more than 100. So everybody was excited. And then on March the 31st, ECMO was successfully removed from this patient, and the patient got better. So this was a great improvement from the SARS treatment. Also, the strategy to treatment also improves. Previously, during the SARS outbreak, we had the Xiaotangshan Hospital. In the COVID-19, we also have hospitals like Huoshenshan and Leishenshan. However, this time we had the makeshift hospital and adopted the strategy to take all suspected cases or potentially infected cases and left no one behind. So this has been a very successful treatment strategy. Another major difference from SARS is that now we have altogether more than 40,000 healthcare professionals from the country to help Hubei Province, in particular Wuhan. The biggest challenge is that about 25% of the patients are severe and critical cases. They rushed into the hospitals, making the hospital resources very much strained. We didn't have enough hospital beds or hospital facilities to hospitalize the patients and treat them. I think this is the biggest challenge we are faced with in the COVID-19. As in SARS, there was no such hospital resource straining or constraint. Furthermore, when we were in Wuhan, we found the streets were quite empty. Only vehicles carrying the healthcare professionals were walking on the street. All of a sudden, the city was silenced. At that time, I felt really touched. Our self-discipline and the government strong response have all touched me greatly. So my personal impression for the COVID-19 response can be summarized as being touched, and also as a common healthcare professional, I feel really proud of my colleagues and the healthcare professionals. As for the nursing question, I will ask Ms. Wang to say a few words. Okay, compared with the SARS 17 years ago, the nursing this time involves more departments and becomes more efficient. For example, we have the lung recovery team who is helping the patients to recover and get well soon. Actually, for pulmonary recovery or rehabilitation, this was an approach that we adopted only recently or over the past couple of years. We have adopted various means to have early intervention to promote the early recovery of the pulmonary function and also the sports functions. For example, we had a case who was a 74 years old grandpa, and he was in critical situation and had to use the ventilator to support his breathing. Also, he was an he was a cancer patient, and he unfortunately was affected by COVID-19. But with our efforts, he got better and better. And then the pulmonary rehabilitation team got engaged. We helped the grandpa to assess his existing functions of the organs.
And then we worked out a comprehensive exercise plan for the exercising of the extremes, limbs, sputum reproduction. After 30 days of hospitalization, the patient could walk on 2 legs, and he can also walk several steps with the support of nurses. When he found he could walk, he was very excited, and that was very inspirational for our nurses. The sweat and the thick protective gears was not in vain. After months of intensive care, the grandpa could not only walk, but also can swallow food and can produce sputum to clear lungs. And that has been very enlightening for us with the specialized training to nurses. Our nursing capacity have improved by big margins. In case of such events, we can play a bigger role, and in the future we need to train more such nurses with multidisciplinary nursing capacity. Next question, please. Thank you. With people.cn, my question goes to President Wang Jianye. You led 150 plus health professionals to the front line, and you've been fighting at the front line for over 90 days. What was your greatest fear? What was your greatest impression? Thank you for your question. As the leader of this medical team, what I feared most were the safety of our team members. Upon our departure, I faced those who were seeing us off, and they had family members, and I promised all the family members and those behind us that I will bring back all the 150 back safely. That was the promise I made. After I came back, after the 14 days quarantine, and the first thing I said was that I honored my promise. I brought back them complete, safe and sound. I can give you back your dear colleagues. And I told the family members of these medical team members that I now return you your beloved ones. As the team leader, my greatest fear was my members' safety. I have been emphasizing this time and again. Without the safety of our health professionals, there is no treatment. The safety of the health professionals is always the priority. In particular, if it was at the beginning of our help, once there was safety, then the entire team cannot fight, because we have been taking the same shuttle bus, we take the same lift, we dine in the same dining room. So with the falling down of one member, the entire team will be gone. 151 among us, among which 79 were party members. According to the decision by the party committee of our hospital, we've set up an interim party organization in this medical team, and we set up 3 sub-branches. In the first meeting we convened, we put forward several questions for consideration. Apart from giving play to the role of the party members and the pioneer role of the party members, we put forward 5 major concerns and attentions. First, we should pay more attention to the work carried out by our members. As head nurse Madam Wang Xia has mentioned, we are not a specialized infectious disease hospital. Apart from the 8 members who were involved in the fight against the 2003 SARS, the rest of us were not specialized in infectious disease. Apart from that, COVID-19 was a completely new virus for all of us. We hadn't met it before. Therefore, the number 1 concern was how should we prevent against any possible infection. And second, we need to explore, along with our efforts, and probe the limits of the trials, probe the effectiveness of a combination, like a pair of physicians from respiratory disease department and internal medicine department. And second focus of our attention was the health of team members. Not only they should safeguard against the infection, but also the long working hours may compromise their immune. So, to speak with candor, what was my greatest impression? Any cough from any member may make me really nervous. I will come up and ask, "Why you're coughing? What do you feel? Do you need respiratory department colleague to check you further?" I would have fidgeted over any cough of any member. Apart from the cross-infection, there were other possible issues like diarrhea or any discomfort with any member. That was my greatest fear. And the older team members may have the hypertension issue or the cardiac issues. The third attention that I've been focusing on are the daily life of our team members. Most of us were northerners. We go to a southern city. We accustomed to the diet. Do our team members like the food? Do they have the good appetite? Can they eat flour-based food apart from rice? Can they have pies, tarts, or dumplings? And that was the winter time. Many members were wearing the winter clothes. Later, weather became warmer, and did they bring with them enough spring clothing? The fourth attention that I've been focusing on was the psychological and the mental health of my team members. Upon our arrival, we naturally had fear. How can I remove and get rid of the fear? I often say the greatest enemy of us is fear itself. To some extent, fear is in itself more fearful than the epidemic itself. If you go to the wards with fear, then that may make you exposed, more likely, to the virus without attending to it because you were too nervous to take care of your precautions. And that may lead to bigger problems. So from the very beginning, one of my priorities was to remove the fear. Later, we have been accumulating experiences. We became familiar with the environment, with the patients, with the virus. And then what I focused on was that we shouldn't slacken our focus, and we should keep unrelenting focus on the personal protection. And the fifth attention I've been focusing on are the families of our team members. They have been away from home for too long. We may be really strong if we were just staying away home for 2 to 3 weeks. Even there were such extreme cases. Father of one of the team members passed away during his fight at the front line, but he couldn't go back to see off his father. There were also team members whose children had to take the entrance examination for the universities. Their spouses couldn't provide learning assistance to their children, and we helped the team members. There was another team member whose father suffered from acute cardiac arrest and failure. So we had to ask colleagues staying back at Beijing Hospital at our base to provide help. There were our colleagues who helped our team members to seeing off their fathers, and also there were colleagues of our team members who helped their fathers to go through the cardiac surgeries. So those were the 5 attentions I've been focusing on, and I'm alone, our team alone couldn't have been through it. It was because of the hospital unity that helped us to get through it.
These examples are really things difficult to forget. I always remember them. Thank you for your question. Well, due to the time constraint, we can only allow 2 more questions, please. On the left, on the 4th row, the reporter in yellow, please. Thank you. With Economic Daily, my question is, during the outbreak, there are many elderly patients. The Beijing Hospital is also famous for its gerontology, so what are the specific measures that you have adopted to treat these elderly patients? We will have Dr. Xi Huan to take the question. Thank you. As you know, that gerontology is one of our highlights of the hospital. In our daily practice, we've already cultivated excellent teams. That is also the reason that when we built the second team of medical experts to Wuhan, in response to the request from the frontline, we engaged the experts from various departments. Indeed, the geriatrics department or geriatric discipline is one of our highlights. We've also been aware that there are needs particular to the elderly patients and also for the radiology. So in the daily practices, our radiologist does not just work in the office and issue the reports on the images. Instead, radiologists are working closely with the clinicians. That's why we had this multidisciplinary team. When the team arrived at the front line, we had the idea to have a multidisciplinary coordination in the light of the local conditions. The wards were previously just transferred, and the space was quite limited. So, taking into consideration the local conditions, we believe that it's necessary to set up a multidisciplinary ward check team or ward inspection team, and also, when necessary, we can have the distance consultation with the doctors and the experts in the back office. So we had this ward inspection every day in the morning. All the experts are joined to discuss the patients case by case. Easy ones can go quickly, while the complicated ones need more time. So such inspection or consultation will take 2 to 3 hours every day. However, such a lengthy consultation has actually improved our efficiency, because this is actually a joint inspection, ward inspection, and then the frontline clinicians can quickly give the prescriptions. Also, the experts from different disciplines can contribute their unique roles. For example, we find that the coagulation function may be problematic. We find this phenomena quite early in the outbreak, and then we decided to adopt a preventive approach against the potential problem. Also, you've heard about the cytokine storm for COVID-19. This may cause the cytokine storm, the potential failures of various organs caused by the cytokine storm could be very serious. That's why we have experts from different departments who have already accumulated a lot of first-hand experience in dealing with the cytokine storm. Then we come up with our own internal criteria and also the protocol to deal with the potential cytokine storm. We have already found this approach quite effective. So these are the examples I wish to share with you today to show the importance of multidisciplinary coordination. Also, when we receive any patient, we not only refer to the previous radiological screen images, but also conduct thorough observation and checkups. For the COVID-19, every day when we discuss the situation with the experts, we found that some patients may show severe symptoms from the radiological images, yet the symptoms, the physical symptoms may not be so severe. However, the situation or the condition of the patient can change very quickly and can exacerbate very soon or very quickly. So the coordination between the radiologists and the clinicians are really important. And also when the patients are expected